Okay, can you review the pseudo complications of the Bowen therapy?
Yeah, I call them pseudo complications because they're seemingly complications are ill effects, but they're really good effects because that means that anything that happens that's unpleasant is really good because the body's changing. You know, what the body doesn't like to change. But you know, when a fever goes up tonight, probably the fever's gone tomorrow because the fever spikes before it goes down. And some of the same thing happens with Bowen procedures. You do a procedure, and sometimes it'll be on the table. Patients will say, "Oh, you just when you come back in the room after you did the pelvis or you did the neck, they say, "Oh, I got this pain in my shoulder." Oh, 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 oh," that they didn't have when they first came to see you today. Don't get alarmed. Say that your body's changing. This is stirring things up. Don't worry. It's a good sign. Okay. And sometimes they'll come back in a week and tell you the same thing. Most of these ill effects that take place are temporary. By the time if they have problems on the table, by the time they leave the office, so probably that issue will be resolved. If they have something tonight when they go home and something flares up or the existing patient pain flares up, probably tomorrow morning or the next day, it'll go away. And so it intensifies certain symptoms that they're having presently. It will bring back old problems that they haven't had for a while. It'll stir up maybe new problems sometimes because they're readjusting and rearranging. And there's reasons for that. It's called a Herxheimer reaction. You can look that up. Herxheimer was a doctor. And for instance, if you prescribe pharmaceuticals for fungus on the feet, the funguses in the feet, when they're clearing up, will appear on the hands out of the clear blue. But it's not fungus. If you culture the hands, you can't get any fungus growth. It's a reaction systemically that mirrors the problem that's going on. And so when doing Bowen therapy, sometimes I think a similar reaction takes place. So that when you're working on the one shoulder, once in a while the other shoulders will start to hurt. Or when you work on the one shoulder, that shoulder will hurt more before it gets better, like spiking the fever before the fever goes on. So those are some surprises, but they're all good because patients are they're changing. Um, Occasionally, not so much with the Bowen technique as craniosacral therapy and myofascial and as other forms of body work, people will go through emotional clearings. And sometimes on the table, sometimes the next day or 2 days later, they'll have, you know, they'll weep and cry or they'll laugh and giggle or they get euphoric because of the endorphins and I had experience with that 6 different women. I have never had one male patient, but female patients, when after they had 2 or 3 treatments, they'd have this aha moment and they leave their spouse or they leave their significant other because they're emotionally, you know, engulfed in this relationship. And I finally felt like they, and I felt kind of guilty that I broke up with a relationship sometimes at first, but then I realized it was for the better for everybody concerned. But those kinds of things happen. So emotional clearings take place. And if you do this on a narcotics abuser or heavy user, they'll go home and vomit afterwards. Uh, Maybe, or they'll get stomach cramps, or they'll get digestive issues that are pretty bizarre, pretty severe. And again, it's only temporary. If they go home and vomit, once they're through, they won't vomit anymore. And they come back the next week for another session, they won't react the same way as the first session. So I usually preempt my patients before they go home, like they might feel a intensification of their pain, new pain, old pain. If they take narcotics, I don't. I just say, I'm sure you don't, but if you, by chance you do, and I'm not talking about just street drugs, but hydrocodone and OxyContin and those drugs in excess. And I have no magic number. I'd say if somebody takes Oh, I take hydrocodone. How many do I take a day? Three or maybe two, one every couple days. They're not going to get sick, but they say, oh, I take two every 3 hours, or 12 a day. Likely they will get sick. So if you pre-warn them, prepare them, then they won't be surprised. They'll come back the following week. And usually once they expel that stored up narcotic, either in the tissues or in the cell membranes, I'm not sure which, or both. Once it's released, and a lot of times their symptoms will get better, like right away. Okay, those are the main surprises.